Welcome to Dr. Sam's Anatomy classes. This is a question paper of a recently held part completion test, that's PCT on General Anatomy, here at Naraina Medical College and Research Center, Panki, Kanpur, in the Department of Anatomy, and this question paper is for MBBS 2021 batch. This exam was held on 22nd of March 2022. So this question paper was of 100 marks, was meant to be solved in 90 minutes. So I'm here to solve this question paper and will explain you a little bit about each of these questions so that this helps you to revise your general anatomy, and this is definitely going to help you in your further exams. This is like 5 set of questions. The first one you can see is about the fill in the blanks. The next one is true and false. And then you have is to underline the correct choice. Then there were MCQs. And then lastly, you have to give examples, a single example of each of these headings. Fill in the blanks. The first question here is total number of bones in skeleton of hand is. So you must have guessed it. It's an easy question. You can solve it. 8 carpal bones plus 5 metacarpals plus 14 phalanges. That makes it 27. Number 2, CSF is formed by choroid plexus. This choroid plexus is a fold of pia mater enclosing a tuft of capillaries lined by secretory ependyma on the lining of the ventricles. So this is the site where the CSF is being formed. Question 3. The best example of vasa vasorum is? Answer is coronary arteries. This vasa vasorum is like an artery to an artery. It's a branch arising from an artery which supplies the same artery. Obviously, this is going to happen in large size arteries because the thickness of the wall matters. So when there's more of thickness of a wall of an artery, that needs more of perfusion. For that purpose, these arteries give out the minute branches which perfuse the wall of the same artery. So remember, the heart itself is a dilated artery with thickened musculature. So the branches arising from its ascending aorta supplies the walls of the heart. That's the best example of vasa vasorum. Question number 4. The largest cranial nerve is? Trigeminal nerve, or the 5th cranial nerve. Remember that largest is related to the bulk and longest is something related to the length. So don't confuse with the largest and the longest. Longest, of course, is the vagus. Question number 5. Largest lymph vessel is? Thoracic duct. Question number 6. Total number of spinal nerves in human body is? 31 pairs. Or you can also simply write it as 64 spinal nerves. Question number 7. 9th cranial nerve is called? Glossopharyngeal nerve. Question number 8. Translucency of the skin is due to dash layer of the epidermis. Translucency is a feature of a thick skin, and thick skin is present on palm and soles. Where you have an additional layer in the epidermis, that's a 4th layer from below, and that's called stratum lucidum, which has this protein called elidine, which is responsible for the translucency of the thick skin. Question number 9 is, dash is an example of multipinnate muscle. So here you can write any of the multipinnate muscle You can write subscapularis, deltoid, but it's the acromial or the lateral fibers of deltoid which are multipinnate. Question number 10. Dash is an example of plain variety of synovial joints. So there is a list of many examples of plain variety of synovial joints. You can mention any of them. chondrosternal joints. Of course, not the first one, because the first one is an example of primary cartilaginous joint. The rest of them from 2 to 7, they are all plain variety of synovial joints. Acromioclavicular, sacroiliac, superior tibiofibular joint, joint between the posterior articular facets of the vertebrae, zygapophyseal joints, uncovertebral joints, that's called Lushkas joints, intercarpal, intertarsal, carpometacarpal, tarsometatarsal, intermetacarpal. So many examples you could have mentioned here in this plain variety of synovial joints. Question number 11. Sharp anterior border of tibia is called shin. Question number 12. Largest sesamoid bone is patella. Question number 13. Best position of patient for doing PV, per vaginal examination, is lithotomy position. Question number 14. Cutting and removal of appendix is called appendicectomy. Question number 15. Dash joints are present only in the median plane of human body. This is a peculiar way of learning the examples of secondary cartilaginous joints. Remember manubrosternal joint, pubic symphysis, intervertebral joint between the body of vertebrae. So all of them are unpaired and they are in the median plane. Question number 16. CSF is drained by arachnoid villi and arachnoid granulations. Now these arachnoid villi granulations, these are formed from arachnoid matter of the meninges, and they are tufted villous processes or pedunculated processes which drain CSF from the subarachnoid space into the dural venous sinuses, mainly in the superior sagittal sinus. Question number 17. Inflammation of bronchus is called bronchitis. Question number 18. Most prominent vertebra on the back is C7, seventh cervical vertebrae. It is also called vertebra prominence. Now starting with question number 2, true or false, underline the correct choice. Question number 1 is tunica media is the thickest layer in a medium-sized artery. So this statement is true. Remember that medium-sized arteries, they have more of smooth muscle fibers and less of elastic fibers in the tunica media, and the thickness of the artery is more than the diameter of the lumen, and the thickest layer of this artery is the tunica media. Question number 2 is retinaculum helps to change the direction of the underlying tendons. Absolutely true. That's the purpose. One of the purpose of the retinaculum is to pack up the tendons and also to help to change the direction. Like in example, you have a posterior retinaculum at the ankle behind the medial malleolus that helps to change the direction of the long tendons from the back of the leg to reach into the sole. And same way is this peroneal retinaculum behind to the lateral malleolus, which also helps to change the direction of the peroneus longus and brevis, as well as the neurovascular bundle passing through these retinaculum. Question number 3 is nutritional artery to radius is directed towards its proximal end. This also is true. Remember, the growing end of the radius is the distal end. In a fetal lying position, the distal end of the radius is towards the head end. So that's the growing end. And the nutritional artery or the direction of nutritional foramen is opposite to the growing end. So the upper end of the radius or the proximal end is the direction of nutritional artery in radius. And by the way, the nutritional artery to radius is a branch of anterior interosseous artery of the forearm. And the same artery also provides a nutritional branch to ulna as well. And the direction of nutritional artery in ulna is also towards its proximal end. Question number 4. C6 spinal nerve emerges from above the 6th cervical vertebrae. This also is true. Remember, in case of C1 to C7 spinal nerves, all these cervical spinal nerves, they emerge from above to their numerically corresponding vertebrae. But this pattern gets changed because of the C8 spinal nerve, which is passing below to the 7th cervical vertebrae, because the 7th cervical vertebrae and there are 8 cervical nerves. So C8 passes below C7 cervical vertebrae, and then onwards T1 passes below T1, T2 passes below T2, and down below all the spinal nerves from thoracic, lumbar, and sacral and coccygeal segments, they pass out from below to the numerically corresponding vertebrae. Question number 5. Preganglionic sympathetic fibers are longer than the postganglionic sympathetic fibers. This is a false statement. Remember that preganglionic sympathetic fibers are shorter. They emerge out from the lateral horn of the spinal cord from T1 to L2 segments, and then they reach and relay, most of them they relay in the sympathetic ganglia. And then the postganglionic fibers, in case of sympathetic supply, are longer in length, and that's why the sympathetic outflow is a diffuse phenomenon. They climb up to the adjoining vessels to reach up to designated organs. So in sympathetic, preganglionic are shorter and the postganglionic are the longer fibers. Unlike this, in parasympathetic, the preganglionic fibers are longer and the postganglionic parasympathetic fibers are shorter, because it's craniosacral outflow, and these parasympathetic ganglia, they are closer to the organs to which they are meant to supply the postganglionic fibers. Sometimes this parasympathetic ganglia are embedded within the organ itself. So the postganglionic fibers in parasympathetic outflow are shorter, and that's why parasympathetic outflow is very much precise in action. Question number 6. Arteries always carry oxygenated blood. This is a false statement. You must be knowing that umbilical arteries, pulmonary arteries, they carry deoxygenated blood. So the better way you can remember is A for artery, A for away from the heart. So the blood always runs away from the heart in the arteries. Question number 7. Fourth rib posteriorly articulates with the fourth thoracic vertebra only. This is a false statement. Remember that, because fourth rib is a typical rib. I hope you know the typical ribs. These are 3 to 9 are the typical ribs. Means these 3 to 9 ribs, they do not articulate with their corresponding vertebrae only. Rather, they articulate with their numerically corresponding vertebrae as well as to a vertebrae higher up, means numerically lesser vertebrae also. So the fourth rib posteriorly will articulate with the third and the fourth thoracic vertebrae. Question number 8. Hip joint matures earlier than the knee joint. This is a true statement. If you compare the hip and knee joints, right? So we are talking is about the femur. So in femur, the growing end is the distal end, and the knee joint is formed by the lower end of femur and upper end of tibia. So both these ends, lower end of femur and upper end of tibia, are the growing ends, and the growing ends are first to start ossify, but they are last to fuse. So they undergo synchondrosis later in life. So that means the upper end, the head of femur, is not the growing end. So that will mature earlier. That will undergo synchondrosis earlier than the condylar end. So that means the hip joint will become mature earlier than the knee joint. Question number 9. Coronal plane bisects the body into two symmetrical halves. False statement. So remember that coronal plane is a vertical transverse plane which passes between the two acromion processes, dividing the body into anterior and posterior sections. But obviously you know that anterior and posterior sections of the body are not symmetrical. Question number 10. X-ray of heart is best visualized in a PA view. This is a true statement. The X-rays, when they enter your thorax from posterior surface, and the X-ray film is placed anterior or adjacent to the front of the chest. So the rays are reaching to the film from behind, and your heart is placed anteriorly in the thoracic cavity. So there is less of divergence of the X-rays after striking the heart. So you get a more precise image of the heart in an X-ray if you are taking it in a PA view. If you take it in an AP view, what you'll find that the image of the heart will become blur because of the divergence of the X-rays. Question number 11. Second rib adjoins the manubrosternal joint on the two sides. This is an absolutely true statement. And remember, this joint is chondrosternal joint, which is a plain variety of synovial joint. And second rib articulating at the sternal angle, it's a surface landmark. It actually also helps you to count down the ribs on the front of the chest on the surface, because this is a landmark where you can easily palpate the second rib. So counting the ribs downwards and laterally, you can palpate the rest of the ribs downwards. Question number 12. Secondary ossification center in a metacarpal is usually at its distal end. This is a true fact. And that's why I remember that these miniature long bones, the phalanges and the metacarpals, they are not considered as long bones. They are actually miniature long bones with only one secondary ossification center. The long bones actually, when I taught you, remember there was a primary center somewhere at the center of the diaphysis, but the secondary centers which appear at both the ends of a long bone with formation of epiphysis, which undergoes synchondrosis at the time of adulthood. But here in the miniature long bones, remember that in metacarpals, the secondary ossification center is towards the distal end, that means towards the knuckles. While in phalanges, the secondary ossification center is towards the base of the phalanges, except the first metacarpal. Now, this first metacarpal has its secondary ossification towards the base, and that's why it mimics, or it's a morphological significance of the first metacarpal developmentally behaving as the proximal phalange of the thumb. This I well explained in one of my videos on the long bones. Question number 13. Umbilical cord has two arteries and one vein. This is a true statement. Remember that umbilical cord has two arteries and two veins in the very early embryonic period, but very soon this one vein, this right umbilical vein, degenerates. So what is left is two umbilical arteries and the left umbilical vein. Remember, left is left. So the left umbilical vein persists till the birth. Question number 3. Underline the correct choice. Number 1. The larger the artery, the more elastic it is. For this, let me tell you, in the arteries, in the tunica media, there are two components: elastic fibers and the smooth muscle fibers. The larger the artery, the more elastic it is, and the smaller the artery, the more muscular it is. And to help you explain this, I'm drawing this graph here. In this graph, you're seeing along the x-axis is the size of an artery. And here you're seeing is the concentration of the content in tunica media. Now, think about this graph here. What is this graph denoting about two of the contents? Is this elastic fibers or is this smooth muscle content? And what about this graph? Is this elastic fibers or smooth muscle? So remember, the green color one shows that its concentration in tunica media is decreasing as the size of an artery is increasing. So this one is going to be smooth muscle fibers. And the blue color line is denoting that as the size of an artery is increasing, its concentration is increasing, and this is elastic fibers. So from here, you got to know that the larger the artery, the more elastic it is. The smaller the artery, the more muscular it is. Remember, we are considering only the large size, medium size, and the small size arteries. We have not included the arterioles in this. And from here also, you got to know this, that the phenomena of vasoconstriction and vasodilatation, this is related to the small and medium sized arteries, because you know that autonomic nervous system innervates the smooth muscle fibers. So they're not going to cause this vasoconstriction and dilatation in ascending aorta, arch of aorta, abdominal aorta, because the large vessels, they're elastic fiber. They're elastic, and the requirement is more of recoil and elasticity in these large vessels. But this phenomenon of vasoconstriction and dilatation is related to the small and medium sized arteries, because the autonomic nervous system is going to act on the smooth muscles. I hope you understood. Question number 2. thick skin has more, less, or no hair? You know, I've been telling that thick skin is present only on the palm and sole, and there they have no hairs. Question number 3 is erection of penis is under parasympathetic or sympathetic control. Remember, I've been telling this that it's under parasympathetic control because that's the thing which causes vasodilatation in the helicine arteries of the penis. Question number 4, thick skin has more, less, or no sweat glands. This also I taught you that the skin which is present on the palm and sole is thick skin, and that has more of sweat glands. Now this sweating is because of the eccrine sweat glands, remember, which open onto the surface of the skin, and this also is related to anxiety related sweating. Question number 5, loss of contact between the articulating surface of the bone forming a joint is called subluxation or dislocation. Answer is dislocation. Look here, if this is a bone and this are the two articulating surfaces of the bone. Now if the two articulating surfaces they slip, why? Because of the tearing of the capsule of the ligament. But if the two articulating surfaces they detach out because they get separated because of the tearing of the ligament on both the sides. So this one is called subluxation and this is dislocation. Answer here in the question is about loss of contact. So the answer will be dislocation. Question number 6. Newton artery to radius is directed proximally or distally. I think this is somewhat a repeated type of thing which has already been asked in your question paper. So, you know, the growing end of the radius is the distal end because in the fetal lying position, the distal end of the radius is closer to the head end, right? So, the nutritional artery will be directed opposite to the growing end, that is towards the proximal end, the upper end of the radius. And the arterial supply to radius is by anterior interosseous artery. Question number 7. Preganglionic parasympathetic fibers are longer or smaller than the postganglionic sympathetic fibers. So, you know that the preganglionic fibers I taught you are longer than the postganglionic parasympathetic fibers. These preganglionic fibers, they are either arising through the cranial nerves or through the S2, S3, S4 spinal segments from the lateral horn. These preganglionic fibers, they reach up to the parasympathetic ganglion, which is much away from the CNS. And so these preganglionic parasympathetic fibers are longer, while these ganglion are either very close to the organs to which they innervate or either they are embedded within the organ. So the postganglionic parasympathetic fibers are very smaller in length. Question number 8. Secondary ossification center is first to appear at the growing end of a long bone. Super important question. There are many questions which you can easily solve here if you follow videos in my playlist. Question number 9. Growth plate in between metaphysis and epiphysis is made up of hyaline cartilage, that's also called physis. Right? This is meant for the enchondral mode of ossification, helping in the longitudinal growth of a long bone, and this undergoes synchondrosis at the time of fusion around 16 to 18 years of life, and that's called the skeletal maturity. Then question number 10, meiosis is a sympathetic or a parasympathetic response of pupil. So remember, constriction of the pupil is called meiosis, which is a parasympathetic response. And dilatation of the pupil is mydriasis, which is a sympathetic response. Question number 11, T4 spinal nerve emerges from above or below the fourth thoracic vertebrae. I already told you the concept here, that will pass below the fourth thoracic vertebrae. Remember the C8 cervical nerve, which is passing below C7 vertebrae. C1 to C7 spinal nerves will arise from above the corresponding cervical vertebrae. C8 passes below C7 vertebrae. T1 onwards, down below all the thoracic, all the lumbar and sacral nerves, they will pass below to the numerically corresponding vertebrae. Question number 12. Lateral malleolus is more anteriorly or posteriorly placed to the medial malleolus. If you see, the talus is actually wider in front. This is the superior view of the talus I have drawn of the right side, so which is wider anteriorly and narrower posteriorly. And here you seeing is the medial malleolus. This is medial malleolus, this is talus, and here you seeing is the lateral malleolus. So you're seeing the anterior border of the medial malleolus is anterior to the anterior border of the lateral malleolus, and this distance here is around 1 to 1.5 centimeter. So answer here that lateral malleolus is more posteriorly placed to the medial malleolus. Question number 13. In a 90-degree flexed elbow, the triangle formed by connecting the three bony prominences, namely medial epicondyle of humerus, lateral epicondyle of humerus, and olecranon process of the ulna, we get is a triangle. Now, this triangle is an isosceles triangle, equitriangle, or scalene triangle. I have already uploaded a video on this, and that's about this triangle called Hutter's triangle. Watch that video, it's a good video, it's well explained there that why this triangle is called a scalene triangle. Question number 14. Second chondrosternal joint is an example of primary secondary cartilaginous or plain synovial joint. So remember, I taught you about this, that the first chondrosternal joint is an example of primary cartilaginous joint because it undergoes synchondrosis and there is no movement of the first rib at this joint. But second to seventh, these are the true ribs. 1 to 7 are the true ribs. Upper 7 ribs, first one is immobile because it has gone fusion. But second to seventh chondrosternal joints, they are plain synovial joints because they permit sliding type of mobility. And remember that movement of these ribs, second to seventh chondrosternal joint, they contribute to increase the AP diameter of the thoracic cavity. And that is done by which movement? That's pump handle movement. Because of these joints, the sternum is elevated anteriorly while deep inhalation, or rather regular inhalation as well. Question number 15. Ejaculation of semen is under sympathetic or parasympathetic control. So this also you need to remember that it's under sympathetic control. Remember, the sympathetic system causes constriction of the sphincters, especially of the GIT as well as this hollow viscera, including the anal sphincter and the urethral sphincters. Because you know that the urethra in males is a urogenital duct for the passage of both urine and semen. So these ejaculatory ducts, they open into the posterior surface of the prostatic urethra. So to prevent the retrograde ejaculation, that semen reaching back into the urinary bladder, there needs to be constriction of this internal urethral sphincter so as to prevent the retrograde flow of semen back into the bladder. So that's why remember that ejaculation of semen is under sympathetic control. Question number 16. The process of embalming of a dead body is done through femoral artery. So remember, after death, the venous system undergoes occluded because of the collection of the clotted blood in the venous system, and the veins are not easily palpable neither in a living age. Further, the walls of the veins are thin and they're valvular also. So why we prefer for the perfusion of dead body by the formalin or the formaldehyde in a retrograde manner through the arteries. So this embalming is done by giving a nick at the femoral artery at the mid-inguinal point, passing a cannula towards the upper end, and then perfusing it gradually with formaldehyde, and then also perfusing the same lower limb by reinserting the cannula at the distal cut end of the same artery. So it's the artery we use for perfusion of formaldehyde in a dead body. That's called embalming. Question number 17. Sixth rib posteriorly articulates with fifth and sixth or sixth and seventh thoracic vertebrae. I already told you that when you talk about the typical ribs, which are 3 to 9. So these 3 to 9 ribs posteriorly at the head end, they have two articular facets. These two ribs, they articulate with their numerically corresponding vertebrae and to a vertebrae higher above, which is actually numerically lesser vertebrae. So sixth rib posteriorly will articulate with the fifth and sixth thoracic vertebrae. Question number 4, that's about MCQs. Tick the single correct choice. You have 12 MCQs. Question number 1, deep fascia is absent on sole, dorsum of hand, face, scrotum. Answer here is face. The entire human body, after peeling the skin, is covered by superficial fascia that's studded with fat. So that also has contours of the body. But after peeling the superficial fascia, what you find is a deep, inelastic, rigid fascia which envelops, laminates the entire human body. So this deep fascia is absent on the face, except at the angle of mandible, where you have is this parotid fascia. Otherwise, there are these muscles, subcutaneous muscles, which was derived from panniculus carnosus, the muscles of facial expression. They take origin from the facial skeleton and they insert into the dermis of the skin of the face. So there is no space left for the deep fascia on the face because of the presence of these subcutaneous muscles being attached to the facial skeleton. So there is no deep fascia on the face except at the angle of mandible. Question number 2. All structures below are modifications of the deep fascia except synovial membrane, intermuscular septa, ligament, peritoneum. Answer here will be peritoneum. This is the lining of the coelomic cavity, which is derived from the intraembryonic coelom, the pleural membrane, the serous pericardium, and the lining of the peritoneum. All these are derived from simple squamous epithelium, right? So it is not fibrous. Let me remind you about the modifications of the deep fascia. There are many modifications of the deep fascia. Deep fascia, when it goes inside, it can form intermuscular septa. Reaching inside, it can form the periosteum, it can form perichondrium, it can form retinaculum, it can form synovial membrane, ligaments, tendons, then meninges, dura mater. There are so many modifications of the deep fascia, but peritoneum is a mesothelial lining of the intraembryonic coelom. Question number 3, which of the following movements takes place around a vertical axis? This also I taught you. There's a video on this about general anatomy, the plane and axis movements of the joints. You can watch that video. Which of the following movements take place around a vertical axis? Flexion, adduction, medial rotation, supination. Answer here is medial rotation. Obviously, you must be knowing what we are talking about is the long bones. Medial or lateral rotation. This happens along a vertical axis. Question number 4. Skeletal muscles are attached to all except bones, undersurface of deep fascia, superficial fascia, interosseous membrane. Answer here is superficial fascia. Remember here that skeletal muscles need something fibrous, something rigid to get attached to, right? So skeletal muscles that gets attached to the bones, to the cartilages, to the underlying surface of the deep fascia, to the intermuscular septa, to the interosseous membranes on outer as well as inner surface of the retinaculum. But superficial fascia is actually loose areolar connective tissue filled with fat. So muscles will not take origin from superficial fascia. There are no muscles which are attached to the superficial fascia. They are either attached to the dermis of the skin in case of subcutaneous muscles. Question number 5. Medial epicondyle of humerus is an example of pressure epiphysis, atavistic epiphysis, traction epiphysis, aberrant epiphysis. This also I taught you. It is still there in this video about the long bones. You can see it. The answer here is traction epiphysis. This group of muscles, the common flexor origin, the superficial muscles of the forearm, they take origin from the antesurface of the medial epicondyle of humerus, and that's where there is a pull. There is a requirement of more of bone for the attachment of these muscles, for more stability and more of surface area. And that's why there is a secondary ossification center which is meant to form this medial epicondyle of humerus. And this is an example of traction epiphysis. Other examples, of course, are lesser tubercle, greater tubercle of humerus, greater trochanter, lesser trochanter of femur. Question number 6. Sigmoid colon is present in. You remember this about the 9 regions of the abdomen? You have is the right hypochondrium. This is the epigastric region. This is left hypochondrium. This is the right lumbar region. This is the umbilical region. This is the left lumbar region. This is the right iliac fossa. This is the hypogastric region or suprapubic or supravesicular region. This is the left iliac fossa. We're talking about the sigmoid colon. See, come with the appendix in the right iliac fossa. This is the ascending colon, and this is the transverse colon. Then you have a descending colon, and in this iliac fossa you find is the sigmoid colon. So the answer here is left iliac fossa is the region where you find is the sigmoid colon. Question number 7. Area between the 12th rib and the iliac crest on the back is called. So in the back, when you see, there's this curvature to the iliac crest, and in between is the sacrum, and here is the lumbar spine, and here you finding is the 12th rib. Then you have 11th rib. So in the question, what has been asked is about this region here, and this region is called loin. This region here on the sides, this is called flanks. Inguinum is the crease created when you completely flex the hip joint. That is front of thigh touches the front of abdomen. The fold created is called inguinum. What is groin? It is the medial surface of the thighs where it touches the perineum. The fold created is called the groin. Question number 8. Dorsal root ganglion is a sensory ganglion, motor ganglion, sympathetic ganglion, parasympathetic ganglion. DRG is actually a collection of the cytons of the first order pseudo unipolar neurons, which are actually sensory fibers. So that ganglion is a sensory ganglion. DRG is actually a sensory ganglion. It also is a reservoir site for herpes zoster virus, which in an immunocompromised conditions can flare up along to the course of the spinal nerve and can cause rashes along to the dermatome which it innervates, and that's called shingles. Question number 9. In an anatomical position, the position of hand is slightly adducted, slightly abducted, slightly flexed, slightly extended. Answer here is slightly adducted. And the reason is at the wrist you have two stelloid processes, ulnar and radial stelloid process. You know that the radial stelloid process is distal to the ulnar stelloid process by 1 centimeter. So the radius actually pushes the hand towards the ulnar side, and that's why at the wrist joint the span of movement in adduction is more and span of movement in abduction is less, because it's a stelloid process of radius which hinders further abduction. So remember, at ease, anatomical position is at ease. When you left your hands loose, you'll find your hand is slightly in adducted position, means your hand is slightly deviated on the ulnar side. Question number 10. What lies immediately below to the epigastric fossa? I have taught you this in a video on general anatomy on cadaver, and where I've taught you about the regions of the abdomen somewhere, and I taught you the terminology epigastric, right? Epi means something above, so epigastric gives assumption of this area lying above to the stomach, but actually speaking, stomach is deeper to that, but not immediately below to this. So what lies immediately below the epigastric fossa is the left lobe of the liver. Below to that is the stomach, and behind to the stomach is the pancreas. Question number 11. Most oxygenated blood in a fetus runs in. The choices here: pulmonary vein, umbilical artery, ascending aorta, umbilical vein. All these are the vessels of the fetus. So remember that the oxygen the fetus is receiving is through the maternal circulation. Remember, so there's a pool in this syncytiotrophoblastic layer of the placenta. with this blood, the fetal blood, it receives oxygen from the maternal blood, and that's why this, and that's how umbilical vein carries oxygenated blood to the fetus. It's the left umbilical vein which is left in the umbilical cord. So this will be most richly oxygenated blood reaching to the fetus. Question number 12. According to the rule of 9, which is used in adults to estimate the burnt area of the skin, which option is incorrect? Trunk is 18%, upper limb is 9%, head and neck 9%, lower limb 18%. I've been telling you many times about this rule of 9. However, in children at different age groups, this rule keeps changing. There's some alteration in children, but you don't have to bother at a stage of first year students. You just have to know about the rule of 9 related to the adults. So in adults, the head is 9% of the total surface area of the body, 9%, head and neck. Upper limbs 9%, lower limbs 18%, and the front of trunk is 18%, and the back of trunk is also 18%. If you add up, you'll find 1% is this, the genital area is 1%. So which is incorrect here? So they've written is trunk is 18%. This is wrong statement. Trunk is actually 18 plus 18% is equal to 36% of the total surface area of the body. The last question, question number 5, give single example of each of the following headings. Number 1 is saddle joint. You can mention any of the examples of saddle joint you know. I'm writing them for your convenience so you can remember them and learn it from here. One you can mention very much easily. Everybody knows is the first carpo-metacarpal joint, that is between trapezium and first metacarpal. Then you have is sternoclavicular joint. Then you have patellofemoral joint. Then you have is calcaneocuboid joint and inguinalomalleolar joint between incus and malleus. Next is sesamoid bone. Any example of sesamoid bone you know? One is patella, the largest sesamoid bone, then pisiform. Patella is sesamoid bone in the tendon of quadriceps femoris. Pisiform is in the tendon of flexor carpi ulnaris, and there's occasional bone found in the lateral head of gastrocnemius, and that's called fibula. There are many other sesamoid bones like in the tendon of adductor longus in case who are professional horse riders, because that muscle adductor longus also called horse riders muscle. Then there are sesamoid bones formed in this muscle of the third layer of sole, that is flexor hallucis brevis. It is bifided muscle having two heads, and in both the heads on the either side of the head of the first metatarsal you find is sesamoid bone in this muscle, flexor hallucis brevis. But those are unnamed sesamoid bones. Then third one is ellipsoid joint. Ellipsoid joint, the examples, the best one is wrist joint. Then atlanto-occipital joint. Then metacarpophalangeal joints or metatarsophalangeal joints. An example of simple squamous epithelium, the best you can write is the lining epithelium of the respiratory unit, or simply writing it as alveoli of the lungs. Then endothelium of the blood vessels. Then mesothelial lining of the serous cavities. Serous cavities like pleura, serous pericardium, peritoneum, loop of Henle, etc. Next, question number 5 is plain suture. Now sutures, they are fibrous joints without any movement permissible, and the plain sutures you find is actually in between the bones of the facial skeleton. So the examples you can write here is internasal suture, Then zygomatico-maxillary suture, fronto-maxillary suture, palato-maxillary suture, zygomatico-temporal suture. This is present in the zygomatic arch. And so many other sutures, you can mention them. There are a lot many examples. Then the next question is about the plain synovial joints. Remember 2 to 7 chondrosternal joints. Okay. Then acromioclavicular, superior tibiofibular joint, sacroiliac joint, joint between the posterior articular facets of the adjacent vertebrae, zygapophyseal joints, uncovertebral joints, which is also called Luskas joints, then intercarpal joints, intertarsal joints, carpometacarpal, carpometatarsal, intermetacarpal, intertarsal joints, right? So there are so many examples of plain synovial joint. You can mention them. Next, question number 7 is hinge joint. Examples of hinge joint: elbow joint, ankle joint, interphalangeal joints, IP joints, pivotal joints. Most important one you can mention here is atlantoaxial joint. Then superior and inferior radioulnar joints, strap muscle, infrahyoid group of muscles. Infrahyoid muscles like sternohyoid, sternothyroid, thyrohyoid, omohyoid. Then extraocular muscles, superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. Example of simple cubical epithelium, this you can write as it's actually a glandular epithelium. So you can find this simple cubical epithelium in thyroid vesicles, thyroid acini, then acini of salivary glands, and remember the basal layer of all stratified epithelium. All the stratified epithelium at the base have the simple cubical epithelium, and it's the germinative layer. It is like rapidly mitotically dividing layer. Question number 11 is about bipinnate muscle. Now, this bipinnate muscle actually is a fibrous septa onto both the sides of this. You find is the muscle fibers fanning out like a feather. So, bipinnate muscle example you can remember is the dorsal interossei. Then in the palm you have the medial 2, which is actually third and fourth lumbrical. This is in the palm. And in the sole, it's the medial 3, that means second, third, and fourth lumbrical. You can add to this is rectus femoris. The superficial fibers of the rectus femoris, they are bipinnate. Talking about retinaculum. Now, retinaculum, there are a lot of many reticulum. You have flexor and extensor retinaculum at wrist. Then you have is posterior or the flexor retinaculum at the ankle. You have extensor or the anterior retinaculum at the ankle. Then you have peroneal retinaculum at the ankle. Talking about bicondylar joint, you have only one joint which is bicondylar, and that is the knee joint. Subcutaneous muscles. Now, the subcutaneous muscles are actually palmaris brevis. Then you have muscles of facial expression. They arise from the skeleton of face and insert into the dermis of the skin of the face. And that's why I told you there was no deep fascia on the face. And all these muscles are derived from the panniculus carnosus, a thin, flattened sheet of muscle more developed in the quadrupeds. Then you have is dartus in the scrotum. This also is a subcutaneous muscle. You can include, although erector pili, this muscle is present in the dermis of the skin. Then talking about large arteries, remember large arteries are those efferent vessels from the heart that includes ascending aorta, arch of aorta, descending thoracic aorta, abdominal aorta, pulmonary artery. 16th is yellow ligaments. Yellow ligaments are those ligaments which carry elastic fibers, and there are two such examples you should remember. One is ligamentum nuchae, that is present in the back of the neck from external occipital protuberance, crossing to this external occipital crest, attaching to the tip of the cervical spinous processes, reaching up to the C7 cervical vertebrae, and that is ligamentum nuchae. It's more developed in horses and the quadrupeds. And then you have is ligamentum flavum. This ligamentum flavum is present posteriorly in the vertebral canal. It's in bits, means it's not a continuous ligament. It attaches the adjacent lamellae of the two adjacent vertebrae. Then eccrine sweat glands. Now, eccrine sweat glands are those sweat glands which open directly onto the surface of the skin, and that are meant for perspiration, for sweating in case of heat or related to anxiety. Such eccrine sweat glands are present more on the thick skin. So examples you can mention is surface of the skin, surface of thick and thin skin. But these are more on thick skin. This is meant for sweating, the watery secretion. Then atavestic epiphysis, this is an example of a bone which was in ancient times was a separate bone. Now in adults it's fused to some other bone. For example, here is coracoid process of scapula and ostrigonum. Ostrigonum is a lateral tubercle on the posterior surface of the talus. Question number 19 is fan-shaped muscle. The best example is temporalis. Question number 20, joint between cartilage and cartilage. This you will find in the costal margin between 5th to 10th ribs. 5, 6 and 7, of course, the true ribs, they reach to the sternum, but they become so closely packed up together that these 5th articulates with 6 to 7th, and 7 to 8th, 8 to 9th, and 9 to 10th. That is how they form the costal margin. But although costal margin is from 7th to 10th and including 11th and 12th behind. But remember that this joint between cartilage and cartilage you will find between 5 to 10th ribs. And of course, there are such joints between larynx also, that includes cricothyroid, cricoarytenoid, etc. Condylar joints, the example you can mention here is TMJ, temporomandibular joint is the best example of condylar joint. Denticulate suture. Denticulate suture you find between the parietal and occipital bone, and that's the lambdoid suture. This denticulate you may also find between the mastoid and the occipital bone. So occipitomastoid also. These are the sites we find denticulate sutures. Question number 23, ball and socket joint. The best example is shoulder joint, hip joint, incudostapedial joint. Then talocalcaneonavicular, which is also called subtalar joint. You can include radiohumeral joint as well. This is between the head of radius and the capitulum of humerus. Now next is joint between cartilage and bone. The best example here is costochondral joints. This is present in all the ribs, and all of them are primary cartilaginous joints. Gomphosis is a joint between root of teeth and alveolar sockets of maxilla and mandible. Primary cartilaginous joints, this are temporary joints. They do not persist throughout life. They are meant for the growth of the bones. They ossify, they increase the size of the bone by enchondral mode of ossification. So after adulthood, they undergo synchondrosis, and later on these joints disappear. Such joints you find between metaphysis and epiphysis of long bones. Costochondral joints. Then first chondrosternal. Then in the base of the skull you find that occipital bone fuses with the sphenoid bone. The body of these two bones fuse, and there's a cartilage in between that was providing for the antero-posterior or the longitudinal growth of the skull, and that joint is spheno-occipital joint. Then you've seen the hip bone, the ilium, ischium, and pubis. So there's a joint between ilium, ischium, and pubis, which actually join together at the level of acetabulum in the ratio of 2:2:1. That means 1/5 is the contribution by pubis in the formation of acetabulum, 2/5 by ilium and ischium. Talking about this multipinnate muscle, multipinnate, you can remember the best example is subscapularis, or the acromial or the lateral head of deltoid. Secondary cartilaginous joint. The easy way of remembering the examples of secondary cartilaginous joint, I told you that these joints lie in the median plane of the body, and that's why these joints are unpaired. So the examples, you can remember them easily. Instead of thinking right and left, you just have to focus on the median plane. So the joints are here: pubic symphysis, manubrio-sternal joint between body of vertebrae. That's intervertebral joint between body of vertebrae. Syndesmosis. Examples. The best example is inferior tibiofibular joint. And because it's the two bones which are held together by a ligament without having any articular surfaces or articular facets, authors have started including intermediate radioulnar joint and intermediate tibiofibular joint because of the presence of the interosseous membrane between the two bones. Talking about simple columnar ciliated epithelium, the best example is fallopian tubes, as well as secondary tertiary bronchus and ependyma of the ventricular cavity of the CNS. Medium size artery, you can mention the secondary branches. I told you the large arteries, the branches arising from the large arteries will be the medium size arteries. That includes carotid arteries, internal, external carotids. Then you have subclavian artery, axillary artery, radial artery, ulnar artery, femoral artery, popliteal artery, posterior tibial artery, anterior tibial artery. All such examples are of medium size artery. Within the trunk also, celiac trunk, superior mesenteric, inferior mesenteric, hepatic artery, so all the branches from these, lumbar arteries, gonadal vessels, etc. The shin dialysis is an exceptional or a special type of suture you find in the skull only at one place, and that is at the posterior nasal aperture, where you find this vertical bone forming the nasal septum, that is vomer at its superior end, it splits to form the ala, and which adjoins the downwards pointed process from the body of sphenoid, and it's called a rostrum of sphenoid. So the joint between the ala of vomer and the rostrum of sphenoid in the roof of the posterior nasal aperture, and that is called sphenovomeral joint. That's an example of shin dialysis. Now, serrate suture. Serrate is a saw-like processes reciprocating into each other's, invaginating into each other from the two bones. Such serrate suture you find is in the interparietal suture, which is also called a sagittal suture. Sometimes you might also find the serrate suture in the frontoparietal suture, and that's called coronal suture. Now, the example of non-hairy skin. Non-hairy skin is a thick skin which is present on palm and sole. The typical spinal nerves are T3, T4, T5 and T6. Only these four thoracic nerves, they have a typical course, and that's a prototype of any nerve. So these are called the typical spinal nerves, T3 to T6. Apocrine sweat glands. Now, these apocrine sweat glands are a part of secondary sexual character, and they do not drain onto the surface. They drain into the hair follicles, and they secrete a sticky, odorous secretion, and that gives the body odors. And these are present in relation to the androgen dependent hairs, and those hairs you find in axilla and in the pubic area and in the perineum. So apocrine glands, sweat glands, you can write in association with axillary and pubic hairs. Thick skin. Simple, you find the thick skin in palm and sole. Remember the importance about thick skin, that in the epidermis you have an additional layer, that stratum lucidum, filled with the protein ellidine, which makes the skin translucent. Further, the corneum, the stratum corneum is the thickest, is a very thick layer here. And additional thing is that the dermo-epidermal junction is well marked to increase the more of surface for the adhesion of this epidermis to the underlying deep dermis. And this skin, thick skin, has more of eccrine sweat glands. Simple columnar brush border epithelium that is meant for absorption. So you will find in all the parts of small intestine, also in the large intestine, lining of the ventricular system of the CNS. You find in PCT, DCT, etc. Now, squamous suture is between the flattened ends of the flat bones of the skull, like between the lateral edges of the parietal bone when it joins the temporal bone, the squamous portion of the temporal bone, and that forms the squamous suture. The example you can write is temporoparietal suture or parieto-temporal suture is the same thing. Lastly, the 40th point is aponeurosis. There are so many flattened tendons of muscles, like the muscles of the anterior abdominal wall. They have flattened aponeurosis anteriorly, forming the rectus sheath. So external oblique abdominis, internal oblique abdominis, transversus abdominis. These are the muscles which have aponeurosis. Then you have is bicipital aponeurosis. This bicipital aponeurosis, remember, it forms the roof of the cubital fossa. Then palmaris longus, which forms the palmar aponeurosis. Then plantaris. This plantaris forms the plantar aponeurosis. And remember, in the scalp also, there's this muscle, digastric muscle, an aponeurosis between the two fleshy bellies, and that is occipitofrontalis. And in between these two muscles is an aponeurosis, and that's called galea aponeurotica. So this was all. I hope you've understood. This will help you in your exams further. All the best.